Good evening. I'm Gary Gilliland, and I would like to thank you for being here tonight. As we reflect back on 40 years of remarkable progress at Fred Hutch, we remain firmly focused on the future. While we have come such a long way and experienced such tremendous impact, we are currently set on a launch pad toward tremendous opportunity. It all started with the pivotal work of Don and Dottie Thomas, the father and mother of bone marrow transplantation. The life-changing work that followed has led to breakthroughs in stem cell sciences, incredible innovations in immunotherapy, and a belief that we can cure the worst cancers. For us, it's always been about the patient. Every Fred Hutch researcher, physician, and caregiver works selflessly, tirelessly, each driven by the one patient we couldn't cure, or the loved one who lived. The mother, the father, the daughter, each fighting for their life. It's the patients, those who have survived cancer and those who haven't, who send us back to our labs with renewed motivation and a real sense of urgency. And now, representing the revolutionary research and the transformative treatment here at Fred Hutch, we share with you the stories of 3 patients who have truly lived.
Our whole life, our whole futures, looked great ahead of us. All of a sudden, I started to have joint pain and flu-like symptoms.
We were trying for a lot of years to have a baby, and then he came along. So it was great, and life was going good. We're 2 professionals working hard and having a good life, and then that stopped for a while.
I was diagnosed with AML, acute myelocytic leukemia. Our son was little, and I just, I couldn't believe that this was happening, that God would do this to me after, waiting so long to have him. My oncologist said to me, I think you should have a transplant, and I want you to go out to Seattle. He said, they're doing phenomenal research, they're having great results, and that's the choice. Before I left, I just said, I was going into the hospital because I was sick, but I was going to get better and I would be gone for a little while. He was standing in the doorway waving goodbye, and as I said, I didn't know if I was going to be coming home to ever see him again. I mean, he was my primary focus. I wanted to be there for him. I had waited so long to have him, so there was no question. He was what I wanted to live for. I don't think there's a greater gift than to see your child become a parent. Never in my wildest dreams did I think I'd see him become a dad.
She described how hard it was, and just fighting to be there when I grew up. I was never really able to wrap my head around what she went through. Probably until I got a little older. I couldn't imagine growing up without her. Now having a son of my own and kind of being the same age as she was, kind of puts it in perspective.
I would not be here today without Fred Hutch. Lives are being saved every day because of the work that Fred Hutchinson is doing.
Meeting the doctors at Fred Hutch, it was a special moment for me because, they saved my mom. But I just wanted to go and say thank you.
Something I don't think anybody could ever be prepared for, no matter where you are in life. So, first person I had to go tell was my dad, and that didn't go over too well emotional-wise. So I think my next fear immediately turned to the girls, being 3 and 5, this is not happening. I remember being shocked when they told me I wouldn't be going home for a while. That's when I started to ask the questions about the duration of things, and I realized I wasn't going to be home for Christmas.
I remember one of the Christmases he was in the hospital. I can't imagine the feeling of being in a hospital room and missing holidays or life events.
Jackie, being 5, she understood that there was something wrong. I don't think she really grasped, how dire things were at the time. It was really hard to explain things because at that age, she would have the tougher questions. Are you going to die, Daddy? And, things like that she was constantly asking, when are you coming home? That was the more difficult one, because she kind of had to evade the actual truth. I really remember the first time of hearing the concept about, instead of bone marrow, was going to stem cell transplantation. At the time, Fred Hutchinson, through their research, was starting to look at that, and part of me was very scared about it. I had one of my initial nurses explain it in very straightforward. We're pushing you to the edge of the cliff, and you're actually going to drop over a ways before we really get back in. So getting prepared for the stem cell transplant, an actual volunteer flies over. She's going to have a cooler, like a 6-pack, and it's going to be in the seat next to her. And that's your immune system coming over. I think we were supposed to do the transplant around dinner time, and it didn't happen. It just got later and later. Sure enough, at 2 a.m. of all hours, she came in the door and she had the 2 infusion bags in her hands, and she said, "Your Mai Tais are here, it's closing time." At 2 a.m., we started the first infusion bag. The reason I did all of it was for the girls. I couldn't imagine them going through school and everything without their dad and not being a part of them. I don't think you could have replaced it with anything else. Nothing would have been that powerful for me.
Fred Hutch has just been a huge part of my family, because part of the reason my dad survived and is still here in my life.
Fred Hutch means hope and courage in life. It's that simple.
When I first got diagnosed, I was 26 years old. I had some pain in my neck. I also had some pain underneath my arm that was radiating from my left side. So I went to the doctor and I just asked him if he could take a look. So I got a call from one of the hospitals in the area, and it just said, "I'm sorry to call you and tell you this, but your blood work came back and it looks like you've got some type of lymphoma, and it appears to be very, very widespread." When I heard that, it just kind of go into a shock. It's just wow, you hear the word cancer and you think, I'm going to die, and everything's going fine, and then now it's, I'm not even sure if I'm going to be alive or if I'll be well enough to walk down the aisle. I remember I just pulled over and called my parents. I kind of set the ball in motion for their recovery plan. I just wanted to make sure I maintained a normal appearance so I could go on with my everyday life. When I was discussing this with my physician here at the Hutch, he explained to me that there is a new therapy out there called immunotherapy. Essentially, you keep your hair, you feel healthy, you feel normal. So right before I started immunotherapy, I had the opportunity to meet my wife. We were at a pool party out in Arizona. She approached me, we started talking, and we hit it off. Sarah and I date for a couple years, and we ended up getting married, and we said, all right, well, we'll give a go at the kids. And I told her, I hope your expectations aren't high. And lo and behold, within a couple months, she was pregnant. Today we enjoy 2 sons. To see where I was at, saying that being a father wasn't going to be in my future, to changing diapers on a consistent basis right now, it wasn't in my wildest dreams. You can't even really explain it, to sit there and look at something that is half you, and to have that love and think to yourself, wow, I'm responsible for you. I'm responsible for making sure that you're on the right path of life. I think it's just one of the greatest honors that you could ever have. And when you come home through the door, it's you know, the dogs running to you. One of the kids is kind of army crawling towards me. The other one's running, you know, and then the wife's behind. It's really a phenomenal feeling. The Hutch has done so many wonderful things for so many people, and it's done an amazing thing for me and my family, which has given me life.
These powerful stories remind us of what we're all here for, of what we're working toward, putting the patient first. Yet our work is not complete. Right now, people are out there with cancer, and too many are dying as we sit here, because we cannot get the therapies out fast enough. We owe it to these patients. These are the faces of the future, just a few of the cancer fighters currently in need of our help, of your help. Recently, we have made major strides in the advancement of immunotherapy treatments, harnessing the power of our own immune system to attack and eradicate cancer cells. Based on our pioneering work in stem cell transplantation, we can now manipulate a patient's individual immune system, creating curative therapies that isolate and eliminate the cancer without affecting any of the healthy cells. Immunotherapy is now working in patients. We're seeing complete responses after one tiny dose of a patient's own re-engineered T cells. We are watching tumors melt away. This is spine-tingling progress. Through our first 40 years, we have made tremendous impact. Yet we are not satisfied. We are 100% committed to curing all cancers. Our mantra is, cures start here. And we truly believe that. And I want you to know that here is right in this room. We are on the cusp. We are curing more patients. We are curing them more safely. And we are living in a decade in which we will create new cures for many, if not all, cancer patients. The pace of this groundbreaking science is constrained only by resources. We have the science. We know what to do. We just need the resources to make it happen. And that's where you come in. Tonight, you may have considered providing support through a generous donation. Thank you. I'm asking you to pause and reflect on the meaningful impact your donation will have. Please consider giving more tonight. We have seen the catalytic effect that funding for researchers can have, and we know we cannot do our innovative work without you. Thank you for igniting the cures. Thank you for being the catalyst. Thank you for your support.
Thank you.
Thank you. Thank you.
Thank you.
Thank you.
Thank you.
Thank you.
Thank you.
Thank you.
Thank you.
Thank you.